Next, I promised you I'd talk about healthcare. So listen, Republicans, I think Republicans have a bad rep in when we talk about a healthcare policy. And the reason is this, like, there's all this idea that somehow Democrats are the ones who care about providing healthcare to American citizens. And that's totally wrong. It's actually absurd, offensive, and wrong. Okay, so it's all three things. Here's the thing with healthcare. I've as you know from my biography, if you've read my biography, you know this. I've experienced a lot of healthcare in my life. Actually, I was talking to somebody today, and from probably January of 2005 to, let's say, December of 2005, I probably personally was responsible for about $12 to $15 million worth of healthcare expenses. So I know healthcare from the user end. I get it. Okay, but the problem with healthcare is this: you get three things. You get price, you get quality, and you get access. And you have to, as a general matter, you have to balance those three things. And so what the Democrats are always trying to do is they're trying to say price should be zero, quality should be high, and access should be high. The problem is that's a unicorn. It's a farce. It's not true. It's impossible. So Medicare for all, failed policy, can't possibly work. It's nonsense. So what's the way that we do healthcare policy in a better way? Here's how we do healthcare policy. First, we trust the free market. The free market system is the best way to provide goods and services, including scarce goods and services. Goods and services like healthcare. Even healthcare, even though it's complex, is provided best by a free market system. Now, there's some things we can do to strengthen the free market system with respect to healthcare. Here's one. First, we need to have health insurance that's able to be sold across state lines. Because right now, in a lot of places, you can't sell or buy health insurance across state lines. So instead of having insurance companies able to find markets and compete and lower prices by competition, instead we have little silos, little like state level insurance marketplaces, and that's the wrong approach. So we need to be able to sell and buy health insurance across state lines. Two, we need price transparency. We desperately need price transparency because here's the thing: most healthcare services are routine, right? If you need a toenail removed, or if you need a colonoscopy, or you need a mammogram, or something like that. Those are things that that are basically the same in between providers. They're not radically different from provider to provider. But what the problem is that too many Americans overconsume healthcare, or they go to their local hospital and they get a colonoscopy and it's $800 when they could have gone someplace else and it would have been $500. And the reason they don't do that is because either they don't know about the price difference or they don't care about the price difference. And so what we desperately need to do is we need to get to a place where consumers are able to see the price of those goods and services and compare goods and services and then buy them sort of a la carte. Not going through one particular provider necessarily, but going a la carte on as many services as possible. Because most services are not ones that have to be managed by the government or by a healthcare company. They can be managed by the individual. If, and this is really important, if the consumer bears part of the cost, right? And what I mean by that is you need to have some skin in the game. You need to care about healthcare because your own price is dependent on. Well, let me see. We need to think about healthcare in a way that causes individuals to be able to see and bear part of the cost of their own decisions. The best way to do that is something called health savings accounts. A health savings account is a tax privileged, meaning it's like pre-tax income. I mean, there's a variety of different ways it can be done, but it's a tax privileged way to set aside part of your income to provide for your own healthcare for yourself and your family. And then if you don't spend all that money, guess what? You get it back at the end of the year. It comes back into your income. And so instead of, like, let's imagine a situation in which your child, you have an 8-year-old, and your child has some sniffles, or maybe even something horrible like vomiting in the middle of the night. Your child is sick. You as the parent have to make the decision. Do I take this child to the emergency room and it costs me $250? Or do I wait till tomorrow morning and take the child to an urgent care clinic and it costs me $40? Well, that's a decision that only you can make. And if you're not subject to the price signal of the free market, you're too often people are going to the emergency room. And so we're overusing healthcare. We're using the wrong kinds of healthcare. And by the way, doctors are having to practice what's called defensive medicine. They're having to defend themselves against frivolous lawsuits because they're having to order tests that aren't really medically indicated and things like that on the rare occasion that it might be some worse disease than what they had analyzed through their clinical judgment. And so doctors need to be protected from that. And that brings me to the last point, which is we desperately need tort reform. We clearly need tort reform, because what that does is it lowers costs, because what happens right now is too many doctors, especially surgeons, but other kinds of doctors as well, are forced to practice defensive medicine, driving up their own costs, having to pay exorbitant insurance premiums in case something goes wrong and they get sued for $250 million or something. And what happens in that case is that cost is passed on to the consumer. So we desperately need tort reform. And those are some things that will help us lower healthcare costs on the provider side or on the healthcare side. But all of that hinges on two things. And these are things that Republicans, I think, we ought to be doing better about, frankly. One, we need high-risk insurance pools. I was talking to a man the other day in Virginia Beach who his daughter is 26 years old. And at 26, she was diagnosed with breast cancer. A bolt out of the blue, right? All of a sudden, she was diagnosed with breast cancer. And what do you do in a situation like that? If you don't have health insurance that'll cover that, and most health insurance won't cover a 26-year-old who gets breast cancer, what do? You're going to need some kind of high-risk pool that goes across the population to help make sure that nobody loses their entire life savings over a bolt out of the blue like a breast cancer diagnosis at age 26. And the last thing, we need to protect people with pre-existing conditions, especially under the circumstances when they're switching jobs. We desperately need to make sure that we are that our insurance system is making sure that people can move in between jobs in a way that they don't lose their health insurance, because that's something that people care about a lot, and it's the right thing to do. It's a morally right decision. So those are some thoughts about healthcare policy. Would love to see your comments in the thing here. I'm going to reach forward and scroll through some of this.